have to tell you, I am here tonight to talk dirty. How many of you came to hear dirty? All right. You'll find that I have a kind of a strange sense of humor, but I think things are always easier to understand and to talk about if there's a little bit of sense of humor about it. So first of all, is everybody here of consenting age? You laugh, but at one of these talks, I was actually banned when it was discovered there was a couple of 15-year-olds in the audience. So our little helpers out front, when I first came in, the first thing I said is, oh my God, how old are they and are they staying? Because it was a bad memory. So opening the door to intimacy. So what is the largest sex organ in humans? Skin. What else? Brain. Okay, so if you got a brain, you don't need anything else? Pretty much. All right. Size really doesn't matter on brains. And you're right, it's the brain. Why do you think that is? Because it works. Because it's all in the head, isn't it? I mean, really, it's all in your perception. Okay. So, let's talk about ways that cancer or its treatment can affect your sexuality. And since I'm talking to a room of cancer survivors, I'm not going to be telling you anything new. Obviously, with the diagnosis of cancer and with its treatment, the physical ability to give and receive sexual pleasure may be changed. Somebody mentioned skin earlier. That's one of the changes we see with treatment, isn't it? Skin changes. Thoughts and body image. Once again, we're talking the brain, right? Thoughts. So how you see yourself. How many of you have an image of yourself still at 30 with long blonde hair? Oh, that's me. Oh yeah, sorry. Huh. But how many of us really, seeing ourselves as we really are is sometimes difficult. I'm always surprised when I look in the mirror that, I've gotten old and short hair, right? And then feelings such as fear, sadness, anger, and joy. Because you experience all those feelings with a cancer diagnosis, don't you? Fears of death, fears of reoccurrence, getting through the treatment, dealing with your family, financial, all of that. And then here's the big one, the roles and relationships. Cancer diagnosis, the treatment really impacts our roles and our relationships. There's an estimate of sexual dysfunction after cancer treatments that range from 10 to 90% depending on the site. It's debilitating physical symptoms such as fatigue, nausea. Did any of you experience any of that? And, when you're in the middle of treatment and you're upchucking your cookies, how many of you are thinking sex? No? Not really, huh? So obviously, that's greatly going to diminish your sexual desire. What a surprise. And even cancers that do not directly affect the sexual organs still have no less an impact on sexual self-image. Hair loss. My 23-year-old brother, when he was diagnosed with Hodgkin's, had radiation. This was back in the 70s, when the guys all had long hair. And so when he received radiation, he lost all of his hair from here back. Now, as you know, with radiation, it doesn't grow back. It really sent him into a spiral. That wasn't his self-image. He was 23 years old with long flowing hair. So greatly impact, even though, the cancer itself, there was no sexual organs involved. So when we talk about our treatment modalities and what their impact is, the first line of defense, or the first line of treatment with cancer is surgery. And surgical treatment, as you know, for cancer can affect sexual functioning by actually impairing the vascular supply. So if you've got gastric cancer and we go into your abdomen and we're mucking around in there, obviously there may be some impairment with your, there's going to be some messing around with your vascular supply to your pelvic area, can be. Years ago, it was a big deal for prostate cancer. That was one of the big issues with prostate cancer and having surgery, is that it caused a disruption of the vascular supply to the penis. And then through a lot of our nerve sparing and surgeries that have come about since then, that is not as much of an issue now as it was when I first started in cancer nursing back in the 70s. By the way, I was 12 when I started. Hormone levels. That's another thing that can really be impacted by the treatment, by cancer treatment. So chemotherapy. When you receive chemotherapy, it's a systemic effect, right? It's throughout your whole body. So it can not only affect your body image, but also your sexual functioning and your fertility. How many of you had a discussion with your physician prior to treatment about sexuality? Very good. Back in the 80s, when I went back to school to get my bachelor's degree, we had to do a little mini research project, and I worked on a dedicated oncology floor. And so I asked that question. And what I found is that nobody actually really talked about impact on sexuality except the radiation oncologist. And we had one that actually did have those discussions and talked about sperm banking and fertility post-treatment. But other than that, nobody really did. So the side effects with chemo, and as like I said before, there's going to be increased fatigue, right? Nausea and vomiting. That's certainly going to diminish your need to get it on, or even thinking about it, right? I mean, that's not high on your list. And then alterations in your body image. There's going to be changes with your hair, your skin, your skin colored. All of those issues come up. Mucositis. How many of you experienced mucositis with your chemo? Mucositis is where you have the mouth sores from the chemo. If you've had 5FU, that's not at all unusual to develop little tiny blisters in your mouth. It's one of the big things we push, is good oral care because of the little blisters. They're very painful. And if you've got little blisters in your mouth, heck, if I have a fever blister, I'm not in the mood for kissing, much less having, those kind of sores in my mouth. So obviously there's no interest in kissing or oral sex with the mucositis. Any immunosuppression may also require a temporary break from intercourse. That's kind of like saying the obvious, isn't it? If you got a low white count, I got a low white count, let's have sex? Not really. You really start thinking of how you're going to protect yourself. So sex kind of drops down, the sexual relations kind of drops down on your list of needs. When you're dealing with cancer and treatment, what's primary is getting through the treatment, right? Making it the next day, the next week, just getting through the treatment. Radiation therapy. How many of you had radiation? Okay. So during treatment with external beam radiation therapy in combination with lumpectomy for breast cancer, women have an estimated 75% disruption in sexual activity. This is a lumpectomy. Imagine what it would be if you had a mastectomy. Back when I started in cancer nursing, they were still doing the radical mastectomies. So up to 79% of women treated with external beam and intracavitary radiation therapy for cervical cancer have reported sexual impairments. You would expect that. If you have a radioactive material inserted into your vagina, there would be a little disruption, right? I mean, that seems logical. But radiation therapy can also decrease a man's ability to have voluntary erections, even though desire and sexual sensations are still present. When I was the director of a cancer center in Visalia, that included radiation and medical oncology. It wasn't at all unusual for our rad oncs to prescribe Viagra and the latest drug to our prostate patients just to maintain their ability to have an erection. They sometimes said what would happen is they may lose the ability during the initial radiation and then it may come back later. But it was, very individualized and depending on how extensive the radiation was. But they still had the desire, right? Hormone therapy, this is huge, and we've been playing with people's hormone levels for years with cancer treatment. Men with low levels of testosterone may experience lowered sexual function. That's not news to anybody, right? Testosterone kind of drives the whole male being. So difficulty in achieving a functional erection, less pleasurable orgasm, or difficulty in reaching orgasm, decreased semen production, and diminished spermatogenesis. I want you to say that 3 times rapidly. And if estrogen is used, estrogen excess, and we do use estrogen in prostate cancer, treatment of prostate cancer, we can use it. It can cause gynecomastia, which is development of breasts, feminization, penile and testicular atrophy, and erectile dysfunction. So you can understand why prostate cancer patients say, hey, sign me up for all that. I want that, right? That's not at all unusual. It's not an unusual treatment for prostate cancer. So, have things changed? We talked about going through treatment, having the diagnosis of cancer. So, has being ill interfered with your perception of who you are, your role as husband, father, wife, mother? Did it? Big time, huh? I mean, suddenly you're the guy who goes out and works 7 days a week, and you bring home the bacon, and suddenly you're just sicker than a dog, puking in the toilet in the mornings and hardly able to raise your head up, and there ain't no bacon because the smell would make you sick. So your perception of who you are changes. If you're the wife, and you've always been the wife, mother, took care of everybody, made sure everybody was okay, and suddenly you can't even take care of yourself. So a lot of how we perceive ourselves is wrapped up in the diagnosis and treatment, and that all changes. Now, does it change back when you are through treatment? You tell me, does it? Does it? Slowly? Can? Yes. And during this illness, has your sexuality, your sexual functioning changed? Oh, yeah. So let's talk about the impact of body image. Like I said, I'm still 30 years old. I'm about, I'm quite a bit thinner, and I have long blonde hair that's parted in the middle. Peace. Obviously, that's not the way I look now. And I'm always surprised, that I'm old. When did that happen? How did that happen? So a lot of us don't realize, the body changes, the changes that we go through. And with cancer and the treatment of cancer, that just really kind of hits you like a brick wall, doesn't it? That change and the realization of that change can greatly impact your quality of life. I mean, I could lose 10 pounds and suddenly I think I'm just the hottest thing around, right? Hey, baby, what are you doing tonight? My husband. 10 pounds makes a big difference to me. So going through the diagnosis and treatment of cancer would really change how you perceive yourself. The outward effects of cancer and its treatment can impact significantly on body image, self-esteem, and sexual desire. That's kind of stating the obvious. And both men and women may be profoundly affected by hair loss. I was really surprised when my brother lost his hair. He saved it. Saved it in a brown paper bag. No, that was a really big deal to him to lose his hair. So what he did is he just grew it longer here to cover up the bald in the back. But it was a big deal to him. Both men and women often lose interest in sex during cancer treatment, at least for a time. And the loss of desire may result from anxiety. Do you think cancer patients are a little anxious? I think so, huh? That's why they developed Ativan. Great drug, right? Depression, nausea, pain are many other symptoms. And then, of course, cancer treatment interferes with your normal hormone balance. You know, we kind of play with your hormones. If you got breast cancer that's estrogen receptive, well, then we don't do the estrogen thing. We try to lower your estrogen levels. If you've got prostate cancer, we try to lower your testosterone. So, I mean, we're just in there just mucking everything up, aren't we? So I love this one. Here's two elephants. Can you see that? The one elephant says to the other one, "So, do you think this tail makes my butt look big?" We're talking body image, aren't we? No, it makes your butt look small. Okay, I'm feeling good. Let's talk about potential obstacles. When you're going through treatment, after treatment, and you're in your nadir, what are the big things they always talk to you about, the docs, the nurses? Your white counts, right? Where's your white count? Those 2 counts you need to know always. Your white count, your platelet count. How many of you track that? Oh, right, it's important stuff. So, when you're talking sex, when you're talking about intercourse, one of the things you're thinking, okay, low white blood cell count, what does that mean? I'm prone to infection. Low platelet count, I'm prone to bleeding. Vaginal dryness, impotence, pain, physical limitations, and loss of libido. Wow. Those are a few obstacles, do you think? So how are we going to overcome those obstacles? This is the important part. If you got a low white blood cell count, you're at increased risk for infection, use a condom. Doesn't mean you have to stop having intercourse, it means use a condom. Good personal hygiene. I mean, you can pretend you're 16 again and go in the drugstore to buy condoms. Woohoo! Low platelet count, the increased risk of bleeding, gentle intercourse. This does not mean running hell-bent towards your partner and jumping on them, okay? Gentle. This may mean that if you're the woman, the female, that has the low platelet count, you may want to be on top because you can control the depth of penetration and the vigor of the thrusts. So think about that. It's also a good excuse to be on top, right? It's all about control, ladies. During this time, this would be really appropriate to abstain from both oral and anal intercourse because of the risk of bleeding. Now, one of the things in talking about this, and sometimes, we all have our own preconceived ideas of what sexual intercourse looks like, or what sex looks like. The man's always on top, we always plan ahead, it's always dark, the lights are off, we don't see each other naked, actually we're not naked. I mean, everybody's got their own ideas. What I'm talking about tonight is going to be a little bit startling. I mean, maybe some of you saying, "Oh my God, she's talking anal intercourse. What's that about?" So what I'm asking you to do is kind of, put all that aside and open yourselves up to new ideas and new thoughts. Doesn't mean you have to rush out here tonight and give it a try, although it may not hurt. But withhold any preconceived ideas of what's right or wrong. Because we're talking about 2 consenting adults, and we're talking about a basic need of every human being. To be touched, to be held, to be desired. So, vaginal dryness. This also happens, ladies, as you get older. I know that's hard to believe, but it sets you up for an increased risk of pain and infection as well. So use water-based lubricants. How many of you seen those commercials about his and hers lubricants? I've always wanted to try those. It's like, wow, maybe we should try that. It looks like fun. Doesn't it look like they've had fun? I'm sure those are water-based lubricants that just smell good. Probably feel good too. And here's one that I always liked. This is my personal favorite, prolonged foreplay. Oh, damn, who doesn't like that? Really? And then use pre-lubricated condoms. They have all kinds of condoms nowadays. You'd be surprised. Or maybe you wouldn't. Impotence. This is a huge issue, can be a huge issue. It's the inability to achieve or maintain erection. Doesn't mean that you don't have the desire. You know, you still may very much have the desire, you just don't have the physical ability. There's medication. We got all kinds of medication. I've never understood what the 2 bathtubs are about. Any of you, do you get that, what that's about, the bathtubs? I mean, I could see it if they were in the bathtub together, but they're in 2 separate bathtubs. But anyway, surgical implants, external devices, pumps, bands. Have any of you heard of any of these? I know the docs have. Pumps, yes. Injections, whoa! That sounds interesting. And positioning. Positioning is a huge, huge help. And once again, positioning. If the gentleman is having a difficulty with maintaining an erection, having the lady on top actually works quite well. Because with the movement of the hips, it almost acts like a little suction cup and just sucks it right up there. So it actually can be quite enjoyable. So try different positions. If you're used to the missionary, position with the man always on top, treat yourself. Ladies, you get on top tonight. It's different, and it can really help with a flaccid penis. Pain. It's surprising how many patients are concerned about pain. Actually, it's not surprising at all. After everything that a cancer patient goes through, I'm not surprised at all about pain. So pre-medicate, and you've heard that throughout your treatment. Pre-medicate, pre-medicate, pre-medicate. Pre-medicate before you come to the doctor so you're not hanging out in pain. Pre-medicate before you go on a walk. Pre-medicate, pre-medicate. Consider anti-anxiety agents, the Ativan. See, I've already upset her. She's going for more food. Once again, positioning and, how you position can help eliminate or limit the pain. And then touching. It's not always about wham, bam, thank you, ma'am. It's not always about penis in the vagina, sex. It's more about intimacy, about touching and being touched. So you can have a whole sexual thing going on without ever having penetration, just through touching. I personally like touching. And if you'll notice on the back table when you came in, there was some nice little handouts that we use with the American Cancer Society on touching. And I would really recommend that you pick them up. I can't find mine right now. Alternative forms of intimacy. And it talks about the value of human touch. And I thought this was interesting. There was a study done that by watching couples in cafes around the world, the study came out that in San Juan, Puerto Rico, 80 touches in an hour between a man and a woman. In a cafe in Paris, 110 touches in an hour. In Gainesville, Florida, there were 2 touches per hour. And in London, England, there were none. The men and women don't touch each other. So I'm booking my next vacation to Paris, France. So take a look at this. It's got some interesting information on it. The one that goes with it is great. It talks about a relaxing hand massage. And once again, we're talking about touch. We're not talking about intercourse. We're not talking about penetration. We're talking about intimacy. And so you start by touch. So, physical limitations, positioning, I cannot stress that enough, positioning, touching, and communication. You actually have permission to talk about what it is you like or don't like. Now, I always assume that my husband, if he really loves me, would know, right? He should just know what I like or don't like. I shouldn't have to tell him. Well, obviously he doesn't love me enough because I seem to have to tell him. And he says he's not a mind reader, so there you go. But we have a tendency not to talk. It's kind of embarrassing and it's kind of, but it really is about communicating with each other. Now that means not only talking, but it also means listening. Yeah, that's a bummer. But yeah, you do also have to listen to your partner. So loss of libido. So manage your troubling symptoms. Fatigue, pain, depression, nausea. Manage them. Pre-medicate, take a nap. If you plan a date that evening with your significant other, then take a nap in the afternoon, right? Don't scrub the floor that day. Don't go out and build an extra room onto the house. Pace yourself. The big stuff's going to happen that night. Save your energy. Go for a makeover. We've got great programs with the American Cancer Society. They got a Look Good, Feel Better program for women. They actually, in some cities, have it for men as well. Because you change as you undergo treatment. Your hair, your skin, all of that. Your coloring, you lose eyelashes. You even lose, hairs in your nose, which could be very distressing. But go for those makeover classes. Nothing lifts, a woman or a man up to know that you're looking good, right? I lose 10 pounds, new makeup, hey, we're hot. Make a date. Make a date with your significant other, just like back in the old days. And here's a challenge to you. Innovate. What does that mean, innovate? Well, I've talked a little bit about that, haven't I? Change your positioning. More foreplay. Nothing wrong with that. And then your body image. Stop and think about your body image. And what you need to know is that you are valued for who you are, not what you look like. And once again, referring you to the back table, exploring self-esteem and intimacy. And talk about affirmations for your new body image. Yes, your body has changed. Does that mean it's a bad body? No. Your body has gotten you through a really difficult time. Cherish that body. None of us look like we did when we were 16. Doesn't mean that it's bad now, does it? I think I actually like myself better. I have finally accepted my fat thighs. Okay? So accept the nude you, and I love this cartoon. So here we got Adam and Eve, middle-aged, right? Not exactly what we think of when we think of Adam and Eve. And she says, I find it a bit awkward dating again at 45. Because haven't we all changed? So this exploring self-esteem and intimacy has some wonderful affirmations about your body image, about your changing role, changing relationships. The first page has relationships, where we're at and why, and it's a little test that you can take with your significant other. And it'll give you some insight into where you're at now. Here's the big one. Ask your doctor. How many of you had felt that you could ask your doctor? Good. Excellent. And if you can't, if you feel that the doctor's too busy or that's just not, you don't have that kind of a relationship, ask your nurse. Okay? And so here's the questions. How will my cancer treatment affect my desire for sex? People do not ask that question. And I kind of understand, because what you're really worried about is, am I going to live, right? That's not high on your list. Okay, but somewhere in that conversation, maybe not the first visit, maybe the 5th or 6th visit, you say, hey, doc, how's this going to affect my sex life? Am I likely to have pain during sex as a result of treatment? I mean, it's not like you only see your doctor one time, right? You see him pretty frequently. So you have lots of opportunity to start asking these questions, especially toward the end of your treatment. How will this treatment affect my ability to have an erection and ejaculate? Now, what I found in my history of nursing is that men will usually ask those questions of their physician when we're talking prostate cancer and in a specific surgery. Anything around the penis, they're very concerned about. So, they're a little bit more prone to ask those questions. Will this treatment cause me to go through menopause? Probably. And it's always, I'm always disappointed at how many women are surprised that they have been thrown into menopause from some of the treatments. So that meant that we didn't do a good job of educating. Will my appearance change? Is there any, this is a huge one, is there any reason why I should not have sex while undergoing treatment? And one of the handouts that I just found, this was funny, when I was preparing this, the funny story about this talk is actually Miriam and I prepared this talk probably 10 years ago, and for an I Can Cope series. I've changed it a little bit during that time, but and the concerns about sexuality kind of come and go. One month it's real popular, and then the next year not so much. Nobody cares if they're having sex or not. But then the next year it's back, because now they realize they've missed sex, and so now they want to go back. So it comes and goes. But I was reading one of my nursing journals, and it talked about long-term survivor sexuality, and it had a really nice little handout about questions to discuss with your healthcare provider. So now we're talking, because we now have long-term cancer survivors, don't we? And so these things are starting more and more to come to the forefront. So now they actually had this, like I said, in a nursing journal, that this would be a great handout, a patient education handout, for questions to discuss with your healthcare provider. And it's a lot of the stuff I've already talked about. So see, don't just make this stuff up. It was actually in a journal, an approved journal. And it just validates the concern that patients, long-term cancer survivors, have over this subject. So, you talk to your doctor. What else can you do? Discuss your fears with one another. Remember, we're talking about that communication thing? Now, here we go. State your feelings positively. Not, man, don't touch me like that, I hate it. Not so good. Maybe you can say, when you touch me there, I really like that. When you do little kisses on my neck, woohoo. Positively. Ask for what you need. And then sexual sharing. And by sexual sharing, I don't mean, if you show me yours, I'll show you mine. I know we did that when we were about five. Yeah, not so much anymore. But really sharing what it is we need and we like from each other. And it may be something as simple as, I really like it when you hold me. Just hold me. Communication, though, as you may have noticed, men and women don't speak the same languages. I'm sure I say one thing, and my husband swears I was talking to one of my previous husbands, because he has no idea what I'm talking about. That's not what he heard. So I love this cartoon. As you can see, it's one lady who just finished a report, and her boss says, "That was a fine report, Barbara. But since the sexes speak different languages, I probably didn't understand a word of it. And that's probably true. So when you do communicate, please remember that there is differences in how men and women perceive what the other is saying. Because it can create a lot of difficulty if you're not careful. Remember, men want to fix everything, where women want to talk about it. You know, we want to build relationships. We want to share. We want to, connect with people. And men just want to fix it. Well, let me tell you what you should do. That's my husband's favorite words to me. Now, Carolyn, let me tell you what you should do. Yeah, right. He says, you're not going to do it, but let me tell you anyway. Yeah, okay. And he's right. I probably won't do it, but, it makes him feel good. So there we are. So let's talk about some common myths. I really like this one. Sex is only for the young and able-bodied, right? I mean, once you're over the age of 80, as I get older, it keeps changing. It used to be 30, and then it was 40 and 50. Sex means intercourse. And now when you're 16, that's what we all thought, right? And then, of course, there was President Clinton who says, I did not have sex with that woman. So there you go. The goal of sexual activity is orgasm. Is it? Oh, that was a Freudian slip. I love this one. Sexual performance equals love. Once again, when you were 16, if you really love me, baby. Remember that one? Sexual activity is natural and spontaneous. Yeah, right. Yeah, at 16, then you stand up and you're a mess. Yeah, not cool. Masturbation is harmful. You're going to go blind. I notice a lot of us wear glasses. I'm not saying anything. And this doctor is telling a patient, a good guideline is that if you enjoy doing something, stop doing it. Now, I'm sure the physicians here tonight aren't going to say that, but here's another myth. And this was really big when I started in cancer nursing in 1978. Cancer is contagious. Cancer is not contagious. It cannot be passed from one person to another. You don't have to worry about giving cancer to your spouse or partner. But I would have patients in the hospital back then whose family wouldn't come visit them because they were afraid they'd catch it. My first husband, you notice my ex-husband, he's ex for a reason, had me take my shoes off outside and not come in the house with my cancer shoes on. That wasn't all that uncommon. Sex is harmful to the person with cancer or his or her partner. So obviously you don't want to have sex with them, right? Because, oh my God. So cancer treatment doesn't make sexual activity dangerous. Check with your doctor. If you have radioactive seeds, how many of you know what that is? Okay, all right. You're receiving chemotherapy and are wondering if you should use condoms during your treatment. Some chemotherapy drugs can be present in small amounts in semen or vaginal fluids. That's true. So use a condom, right? You're considering a form of birth control, as chemotherapy drugs may cause birth defects. And that's very true. So always, and every medical oncologist or radiation oncologist will tell you, you need to use birth control while you're undergoing treatment. Sex can cause problems with cancer treatment. So you don't have sex because it may screw up your cancer treatment. For most people with cancer, having sex is not harmful, but sometimes you may need to wait a while before having sex because bleeding, right? We talked about that. Infection. And you do not have unprotected sex if you or your partner has other sex partners. So if there's multiples, you need to be very careful because you're at risk for infection. So you need to be sure and avoid any risk of infection or STDs. I have to tell you this funny joke. STDs is sexually transmitted diseases. We all know that, right? But in being in administration the last 15, 20 years, they talk about STDs all the time, and I always have to stop and think, oh my God, we're at board meetings or whatever, and they're talking about STDs. It's also short-term disability, which really has no relationship to sexually transmitted diseases. But that's where my mind goes immediately. So strategies. Ask your doctor and nurse, right, about the usual and expected effects of cancer treatment on your sex life. Be informed. Take control. You did that during your treatment. I mean, I'm sure you all looked up your treatment modalities. You were informed consumers. And now it's the same thing. You need to be in control. Find the information. Talk to your docs. Talk to your nurse. Remember to keep an open mind about ways to feel sexual pleasure. It may not be anymore the missionary position. It may be something wild and fabulous that you wish you would have thought of years before. It may be swinging from a trapeze. It's okay. All right? Watch when you descend, though. Dismount, I guess it's called. And consider sexual counseling with a sex therapist. Okay? For problems caused by anxiety. Anxiety can be huge because you put so much energy into dreading it or to not knowing what to expect that it takes all the pleasure out of it. In those cases, that may be where you just start with touching. Do the hand massage, the little handout that I handed that's in the back. Start with the hand massage. Try that. If you're really anxious, another thing that I think is a nice, it helps relieve the anxiety, is just to get naked, lay in bed, hold each other, and it's a no intercourse night. I mean, you set the rules. This is no intercourse. We're just going to lay here and touch each other. We're just going to hold each other, because that's what it's about. I mean, you can always do the intercourse thing later, but you need to start out slow. Stay active, right, to fight depression. I mean, we all know if we sit around long enough, right, we get depressed. It helps to reduce stress and anxiety also. You notice this couple's hiking. Consult your doctor on appropriate types of exercise. I can't stress enough, use touching, holding, caressing. That's just so, so important. Talk about your fears. I love you, but I'm really afraid. I'm afraid you're going to hurt me. So I get to be on top. No. Well, that's one way to start, right? So remember, survival overshadows sexuality. So when you first started with the diagnosis of cancer, when you first started in your treatment, sex wasn't high on your list. What was high was surviving. But as you've moved through that trajectory, and you're now on the other side, and you're picking up the remnants of your life, and you're reestablishing your life, sexuality is going to come back. Because that's who we are. We are sexual beings, each and every one of us. So expect the unexpected. Give yourself time. Give yourself permission. And talk and listen to each other. Communication. And, take the pressure off intercourse. I've already said that. This is a just get naked and hold each other night. It's a get naked night. That's what we should have. Miriam, next time, let's do that. Just get naked night. Everybody come in and just get naked. Except for the speaker, of course. Don't let your diagnosis dictate what you can do sexually. That's not who you are. You are not your diagnosis. And really importantly, you are loved for your total worth, not just the appearance of your body. Because you know what? If it was just the appearance of our body, everybody would still be in love with Bo Derek, who was the perfect 10, remember? Yeah. As she bounced down the beach. Yeah. There wouldn't be much luck for any of the rest of us. So it's all about who we are, the total picture of who we are. And here's the good news. You don't have to do it all by yourself. So, I love this picture. This is a really sexy couple, don't you think? You see the smiles? I think they're very intimate. What do you think? Okay, thank you.